Like most years, health news in 2018 offered a fair share of ups and downs, starting with a big scare for parents across East Tennessee. In June, an E. coli outbreak from raw milk sent a dozen children to East Tennessee Children's Hospital. Some went to the intensive care unit.
We'll see sporadic cases, maybe 2 or 3 at a time, but this is way more than I've ever experienced before here.
Another scare that bookended the year, the flu. After last year's flu shot missed the mark and tens of thousands of people lost their lives, all eyes were on the shot's effectiveness for late 2018. It's still too early to tell how this one will stack up, but as always, younger, older, and pregnant people are most at risk.
They looked at our vent and they told us that is completely normal.
Mold this year brought shakeups to campus, showing up in several dorms and forcing the complete evacuation of one. In 2018, we also learned 2 long-standing East Tennessee hospitals would close. Tenova announced Lakeway Regional in Morristown and Physicians Regional, previously St. Mary's, wouldn't run through the year. But 2018's health news wasn't all bad. Those closures coincided with growth for Fort Sanders, which announced a plan for a $115 million expansion, doubling the size of the emergency department and critical care unit.
He was actually buried in that uniform. And it's painful to think that that little device could have saved him.
Finally, an East Tennessee mother fighting for her son's legacy accomplished her goal. 9 years after Tanner Jameson died from cardiac arrest with no AED to save him, his mother Rhonda and Congressman Jimmy Duncan passed a bill in the U.S. House encouraging all states to require schools to have AEDs. A year of highs and lows, still marked by progression, moving forward to a healthier and happier East Tennessee.